Meet Sue, a professional healthcare worker in a hospital facility. Sue will provide care for a patient who has a rich and long clinical history captured in a large collection of clinical notes. Before seeing the patient for the first time, Sue must get acquainted with the patient's clinical history through a comprehensive chart review of the patient's electronic health record. We introduce ChartWalk, a novel visual analytics tool that supports effective navigation, summarization, and marking of large collections of clinical notes through a hybrid text plus graphics approach. Let's see how Sue would approach her task using this tool. ChartWalk has several main panels. Starting from the mentions view here, Sue begins her review by examining frequent mentions extracted from the clinical notes for this patient. For instance, the frequently mentioned problems, which are organized by category and sorted by frequency, with the most prevalent issues appearing on top. For each extracted mention, a sparkline shows frequency trend over time. At a glance, Sue identifies that this patient has suffered multiple gastrointestinal issues with vomiting improving recently but other symptoms flaring up. Mentions are automatically extracted from clinical notes, and the list of alternative spellings for a given mention can be revealed on hover. Labs and measurements are also summarized in this panel, and when available, related numerical values extracted from the notes are plotted over time. You can inspect individual values and click to redirect to the original note. By browsing through this panel, Sue starts to get a general picture of this patient's health state and medical concerns. She identifies diabetes as a prevalent problem, along with a number of other ongoing issues, including pain, gastrointestinal, and cardiovascular issues. In the snippets view, Sue can see highlights, which are mini segments from notes pre-selected by colleagues who already had a look at this record. The highlight for this patient provides Sue with important context related to diabetes, but also social context that colleagues deemed relevant to emphasize here. From these highlights, Sue gathers that the patient has been struggling with controlling her diabetes and that aggravating issues have trickled over time. As Sue scrolls through the highlights, the calendar view indicates where in time the visible snippets come from. You can also click on the snippet of interest to get redirected to the original note. This calendar view is a visual summary of all of the documents in the patient record currently presented, from oldest on the top to recent most at the bottom. Each row is a month, and every row marker is the day when a note was written, colored by note type. The bar chart on the side shows how many notes were written each month, stratified by type. And the gray intervals here show episode of care, which convey time and duration of interval hospitalization stays, and the notes generated then. Given the very active recent history of this patient, Sue finds it more appropriate to look in reverse from the present day and back in time. And she wants to dive deeper into the discharge summaries shown in red by muting the other types of note via the interactive legend filter bar. She navigates to the latest discharge note from the calendar view, which instantaneously appears in the rightmost panel of ChartWalk, the note view. The note view shows a full selected note. To facilitate navigation, ChartWalk automatically extracts and formats selection headers. Upon inspection of the discharge summary, Sun adds her own created highlights to the list with a click. Her review of this note consolidates her initial impressions about the patient and she concludes that a closer examination of the issues related to diabetes is in order. She starts by retrieving occurrences of diabetes-related mentions from the mention lists. Here she pulled all snippets containing diabetic ketoacidosis from the notes, now visible in the snippets view, which she can use for a targeted systematic review of notes. All of this while contextualizing her analysis temporally through the timeline at the top and histogram on the calendar view, which goes through prevalence of search results over time, and the emphasis in the calendar view through visually muting all notes but the ones that contain a mention of diabetic ketoacidosis. These views help Sue gain a better temporal awareness of how the different issues have persisted over as documented in the notes. She also performs a few quick searches by directly querying for the key terms that she is interested in, like sugars here, which is a recognized clinical mention. Within the few last minutes before I encounter with the patient, Sue decides to get better acquainted with the family situation of the patient. She thinks getting into the first consultation with such awareness will facilitate discussion and help build rapport with the patient as she handles the sensible topic of children with caution.